Hello everyone, welcome back. Let's go through the spirometry report I shared with you in my community post. So far, only 2 people have responded, but those responses were wrong. So I thought let's explain this topic again. If you already know how to interpret this, you can skip this video. Others can stay with me. So before moving into the discussion, just one question for you guys. What are you thinking about this topic? Is it important or not? What are you thinking? It's really important topic, guys. Do you know why? Spirometry is available as an office test in Australia, and most of the GP clinics have the facility to do this. So as a GP, you need to do this test and interpret the report to the patient and make a management plan for your patient. Not only that, this is such an important topic for your AMC clinical as well. And they will give you the report, the spirometry report, and will ask you to interpret as a task, either to the examiner or to the patient or to the bystander, like that. So this is such an important topic, so take it seriously. Now let's begin our discussion. So this is the report I shared, and let's go through the main headings in this report first. So what is spread? Predictive value. That means the value we expected from the patient, or the value we expected from a person with same height, same weight, same ethnicity, same age of that patient. So that is the expected value. What is LLN? Lower limit of normal. ULN? Upper limit of normal. What is pre-bronchodilator value? Our first test value. What is percentage spread? The percentage predicted value. So this is the first part of spirometry. The next part, what is post-bronchodilator value? Your second report. The value you get after the bronchodilator puff. What is percentage spread? Same, the percentage predicted value. What is percentage change? The change in percentage of predicted value. So another important point you need to keep in mind, in some spirometry reports, the predicted value may be mentioned as normal range or mean value. So the predicted value may be written as normal range or mean value. Also, the patient's measured value, the pre-bronchodilator value will be written as the measured value or actual value or baseline value. So these things you should keep in mind. Now about the parameters, different parameters, so in which you need to focus on only these 3 things: FVC, FEV1, FEV1 by FVC ratio. These 3 parameters are the major or important ones you need to focus during the interpretation of a spirometry. What is FEV1? What is FEV1? The amount of air you can forcefully breathe out or blow out in the first second after a deep breath, deep inspiration. What is FVC? The total amount of air you can blow out after a deep inspiration. So at the first second it is called FEV1. Total amount is called FVC. the ratio is FEV1 by FVC. Okay. So what is next? You look at the FEV1 by FVC ratio. So if the value is low, there is a possibility of obstructive lung disease. If the value is normal or high, possibilities of either restrictive lung disease or normal ventilatory function. So look at the patient's report. What is the patient's FEV1 by FVC? The pre-bronchodilator value 0.74. This row you need to look at first, and you need to compare that with the lower limit of normal if you have the lower limit in the report, or you can also compare that with the predicted value if the lower limit is not there. Here the lower limit is there, so we can compare that with lower limit. So the expected lower limit is 0.70 and the patient had 0.74, and this is in normal range. That 0.70 to 0.89 is in normal range. So patient have a normal FEV1 by FVC ratio. So what you can infer from this? Patient will be in this group. Either patient have a restrictive lung disease or the patient have normal lung function. Now what is the next step? You look at FEV1 and FVC report, in which the FVC is more important than FEV1, and if the value is low, there is a possibility of restrictive lung disease. If the value is normal, there is a possibility of normal lung function. Okay. So what is this patient's FVC? 7.40. And what is the normal limit? 5.28 to 8.06. Lower limit is 5.28. So it is in normal range. Okay. So FEV1 by FVC is normal and the FVC value is normal. Also the patient's FEV1 is in normal range. You can see the 4.13 to 6.26 is the range, normal range, and patient have 5.44 FEV1. So the patient have normal FEV1 by FVC ratio and normal FVC. So what is the patient's condition? Patient is with a normal lung function, normal lung ventilatory function. See, these are not the things I created for interpretation. These are something given by Australian Asthma Council for medical practitioners. So this is from their latest spirometry handbook for interpretation of spirometry. So what is the first step? As you can see, the first step is check the shape of the curve. If you have the shape of the curve with you, you can first check that, and if that is normal, you can directly interpret that as normal report. Otherwise, you need to go for the values, the further values. The first value you need to look at is FEV1 by FVC ratio. If that is less than lower limit of normal, what? There is a possibility of obstructive lung disease. See, you need not worry about the mixed pattern. For AMC exam, you will not be given a mixed pattern usually. So either there will be a restrictive lung disease or obstructive lung disease or a normal patient. You will not be given the mixed pattern for your AMC exams. So you need not worry about this FVC interpretation in this scenario. So if you get a FEV1 by FVC less than lower limit of normal, you can directly go for obstructive for your exam, for your AMC exam. And for differentiating between the COPD and asthma, you need to go for post bronchodilator response as next step. Okay. Now, if FEV1 by FVC ratio is normal or high, there are two possibilities. Either you have a normal lung function or restrictive lung disease. So next step, you need to check FVC. Also, you need to check FEV1. But the important value is FVC. FEV1, if that is normal, you can interpret that as normal lung function, normal ventilatory function. If the value is less, you can go for restrictive lung disease. And these are some severity grading, mild, moderate, like that. But previously the criteria was based on the FEV1, but now it is based on Z value, Z score. We have already covered this part in the previous video, and this is for post bronchodilator response to differentiate the asthma and COPD. As per latest criteria, 10% will be the change. This is the flow volume loop. On the left side, image A is what? Asthma. There will be a significant response to bronchodilator. And image B will be COPD. There will not be any significant change for COPD. In asthma, there will be more than or equal to 10% change in FEV1 percentage. So this is just for your revision. Different abnormal patterns, obstructive, restrictive, and mixed. But for AMC exam, you need not worry about the mixed pattern. And in obstructive, what is the pattern? Expiratory airflow will be limited, unable to blow out quickly. The patient will be unable to blow out quickly. What are the conditions? Asthma, COPD, or asthma COPD overlap. In spirometry, there will be low FEV1 by FVC, and there will be a concave flow volume curve. And in restrictive, there will be small lungs. Example, pulmonary fibrosis, interstitial lung disease, pleural or chest wall disease, weak inspiratory muscles, rib deformity, or obesity. There, low FVC will be there, FEV1 by FVC ratio either normal or high. The flow volume curve shows small volume. So these are the definitions. Cystic fibrosis will be one example for mixed pattern. So that's all for today, and I also want to say one thing. I really value your sincere feedback. That's the only way I can improve these videos. But some viewers just give a dislike and leave. And if you can mention why you disliked it, that would be a more helpful one for me. So please do it if you don't like the video. And if you like the content, like, share, and subscribe to my channel. If you have any queries, please drop them in the comments. And thank you for watching.